My name is Oliver Grundmann, and I'm really excited to welcome Dr. Marek Schwendt here. Dr. Schwendt, do you mind introducing yourself?
Hi, to all listeners of this podcast. My name is Marek Schwendt. As you just heard, I'm an associate professor in UF Psychology Department. And we don't have little sub-departments, but technically I'm in the area of behavioral cognitive neuroscience.
Okay, that's great. So we, as part of U of Care, we have a very diverse faculty and researcher list that all work in different departments and in different units at UF. And I think that makes it really a very collaborative atmosphere that we have overall, where we can look at both preclinical and clinical sides of addiction, drug addiction, but also kind of tie the things together in terms of a translational approach. Can you tell us a little bit about how you got into the field of addiction, your background?
Yeah, so my major actually is in biochemistry. Probably not sure I had much of a choice because my dad is a professor of chemistry, and so I was steered towards that. So yeah, I was interested in sort of biological mechanisms of processes, right, and different things. Memory, I remember early on, and and at some point, I wanted to see a bigger picture, and as much as I like to study, the biochemical processes, it feels kind of limited, right? It's very narrow. You don't learn about sort of this big umbrella processes that governs our, body and mind. And so sort of it was for me to it was a door that opened to, hey, I want to see how things work in a bigger scale. And so, and then I did my graduate training in neuroendocrinology. Basically studying stress and different adaptations to stress and maladaptations. And this was all in Slovakia, where I was trained and did all my graduate training. And that sort of got me interested. We started doing some studies a little bit on interaction between stress and addictive drugs, and sort of did little experiments with morphine, and that was all I could do because we didn't really were equipped to do any advanced addiction studies there. And so I really got interested in the topic, and basically that's what I pursued for my postdoc, and I came to America for that.
And you got stuck.
Right. So, I was planning to do a 3-4 year training. This was in Medical University of South Carolina, which have a very strong addiction research program, both clinical and preclinical. And so I wanted to just soak up all the what they have to offer, and basically come back to Europe to start my own lab. But that changed, and I stayed a little bit longer. And then for personal reasons, I started a family in the States. But also, as I grew older, I realized that there are definitely, from colleagues who try to come back, that there are some challenges to coming back to Europe and starting your own lab on its own. And it seems like this is a better, more natural way for me just to stay here and pursue academic career.
Yeah, I think that happened to me as well. I'm originally from Germany, so I understand how things sometimes change as you go along, so to say. So based on your interest in getting into the addiction research field, what kind of made you then particularly focus what you're currently doing on particularly stimulants and stimulant addiction research? And I gather that you are looking both at, or you focus on in preclinical, but also translational aspects of it, right?
Yeah. So the laboratory I started my postdoc in, so that's sort of I originated there. There were two strong labs. One by Dr. Kalivas, which was sort of a next door lab, and one by Dr. McGinty, which was sort of my mentor. It was a psychostimulant heavy research, and as we know, the sort of what people study and what is the sort of societal demand on what we need to be studying changes with these drug waves as they come and go. But nevertheless, this was sort of we've been studying, and we still have a problem with them despite changes, in sort of perception in the society. What is the urgent problem? Opioids. If you look at stimulants, they still remain a problem. If you look at the overdose deaths and problematic use, and people have trouble quitting, right, or managing their use. Cocaine or methamphetamine, things that we're studying, is still a problem, right, and never sort of went away. And sort of is behind the curtain of all that opioid attention to opioid, which is definitely a problem, but they sort of didn't. These stimulants never went away. And one of the things which was interesting to me, as a sort of as a societal or kind of personal interest and need, was that we still don't have FDA-approved treatments for stimulant abuse. So we have something for opioids, we have something for alcohol, but this is still an unmet need. So this sort of is my motivation to I stuck with stimulants, even though we're doing an opioid. We can talk about it. We do some opioid research now too. But this is sort of, I stuck with those models. And, from a practical point, if you talk to researchers who do preclinical models, it's somewhat easier due to pharmacokinetic properties of these drugs to have animals to acquire more complicated schedule of reinforcement with stimulants rather than maybe some opioids or some drugs that are less reinforcive, probably have some aversive effects that accompany the main effect of a drug. So it was for us, and we can get to that because we're interested in doing some more complicated, demanding studies for our animals. So for that purpose, both that we need to be studying that, and stimulants allow us to study these different aspects. That sort of drove the research.
Yeah, as you already pointed out, there are currently no FDA-approved treatments for stimulant use disorders, which is really a lack that should be addressed as soon as possible, given what we have been through, the unique methamphetamine problems, for example, that seem to be reemerging again after some waves have come and gone over recent decades. So your particular focus seems to be on glutamate receptors, or recently on glutamate receptors. Is that something that you think might provide for a target of stimulant use disorder treatment?
Yeah, that's a good question. It's a both curse and a blessing, right? Glutamate is such a great target or tool in sort of to develop treatments via glutamatergic mechanisms for many disorders outside substance use disorders, because it's such a important modulator of brain plasticity. And what we're really trying to do is to, in the essence, for substance use disorder and for anything else, really, for in the realm of mental health, is to sort of reverse some pathological brain plasticity. And this seems to be the vehicle that it's utmost suitable for that. So that's a positive side. The negative side is that since it's so intimately involved in many core processes that are essential for normal brain plasticity, right? There's some significant side effects, so you need to sort of. So the challenge with glutamate is not that it's a bad target. I think glutamate's a fantastic target, and particularly what my lab's been studying metabolic glutamate receptors that seem to be a good target to sort of more gently modulate the system rather than sort of have an on-off modulation. The challenges always remain. What are the side effects, right? Are they typically what you see with glutamate? Any sort of interventions, experimental interventions, that there are some, psychomimetic effects. There could be some memory and learning effects, cognitive deficit. So this is something people know, but people who are sort of studying, researchers looking at glutamate in substance abuse disorders or any other disorders. Sort of this is not always studied. So something we can talk about that. We'd be interested in sort of looking at how to manipulate glutamate receptors or metabolic glutamate receptors in a way that it's the least damaging to sort of normal cognitive processes.
So, given, for example, the GABA and glutamate kind of balance that we homeostasis or whatever you would call it, we obviously have particular drug classes, benzodiazepines and barbiturates, to target kind of the major inhibitory neurotransmitter with GABA. But it seems, like you said, rather challenging to find something equivalent that targets particular glutamate receptors that might be playing a central role in substance use disorders or stimulant use disorders. From what I gather, you seem to be looking at a particular glutamate receptor, or have identified a glutamate receptor that plays a role or has been in particular linked to brain plasticity related to substance use disorders.
Yeah, so I mean, we looked at several subtypes. As I said, we think that these receptors are interesting because they're, the pharmacology is getting better. That there's more drugs available for us to test in experimental models. And particularly what we're looking at is sort of these gentle compounds, right? Some of these positive allosteric modulators that sort of modulate the activity of receptor just a little bit, right? To give us some synaptic benefit that is have a less chance of adverse effects. And so in particular to your question, so we've been mostly studying the 5 and the 2,3 subtypes of these receptors, just because they have a well-researched role in how they regulate, plasticity under normal pathological conditions. And so a lot of times what I find myself reading are papers outside addiction, because that's been more research, these receptors in these other models. So, but it's still very informative. If I learn about, a lot of comes from pain research or Parkinson's research, where people study these basic mechanisms. Hey, what are the good tools to target these receptors to sort of modulate synaptic transmission one way or another to have some kind of a behavioral outcome? And so a lot of the information we use for addiction research come from these other fields. And frankly speaking, that's where the money has been for the commercial research on these receptors. All the drugs that are put out there for the clinical trials, well, none of them really made it through until, I don't think there's anything. It was a Fragile X. Same time there was a schizophrenia applications like that. And so there's been interest in these compounds, not so much particularly in addiction, but in the other applications. So so I think there is a there's a good reason for us to continue this research, if we have a little bit better tools and understand how we can manipulate these receptors. And the trick of the trade really will be in the future to figure out how we can manipulate certain subfactors that fix the signaling for some receptors that drive motivation or drug seeking. Mostly maintain or not affect receptors that might be in both cognition and memory. And so this was sort of like our big interest. How do we do that, right? That's a sort of $1 million question. And so so what we've been doing, so we started by basically, so a lot of the work we do is it starts with like, how can we make a better animal model to study this phenomenon? And then we sort of come in, okay, how what part of the brains are activated in that model when animals, seek the drugs. We look at, CFOS mapping or some meter early genes to sort of understand what part of the brain in that particular situations are recruited. And then we kind of look at, well, is this activity related to metallotropic glutamate receptors? What happens if you manipulate them locally, genetically, or systemically, and then sort of bring it back and say, well, do these specific manipulations have any outcome on, our major dependent variable, our major parameter we follow is basically reinstatement or relapse of drug seeking, right? We look at a bunch of other parameters, but this has sort of always been something that we looked at, when animals for various means stop taking a drug and then they have a reinstatement test, how is our treatment reducing drug seeking, right? So this is sort of our main outcome, besides watching other parameters, following other things we study. Cognition, we can talk about that a little bit. So yeah, so what we want to do is that the interventions that we test in animals, and I should say we use rodents for most of the things we do, is that then going back, and is that intervention affecting cognitive processing, such as working memory, episodic memory, cognitive flexibility, and things like that. So That's been sort of our excitement, sort of look at these both of these worlds. Are our interventions effective for against drug seeking, and our interventions are gentle towards cognitive processes. And one thing, should be maybe stressed out to listeners is that um, uh, this is not just the sort of following side effects of a drug. Um, we know from human literature or from animal models that cognitive function is affected by drug use. So we should not only, our goal really should be not affecting that function, if anything, but perhaps even improve it, right? So another way of looking at it, can we use some of these glutamatergic compounds as a nootropic drug? Can improve some cognitive processes, and can that have some sort of um, uh, secondary or translated outcome on reducing drug seeking, right? So what is the sort of one of the things we're looking at? What is what are these drugs do in these two situations, and what is the relationship? Is it a relationship between certain cognitive domains and drug seeking in that context? Yeah.
I think that's fascinating when I think about something like methamphetamine, which is primarily acting on monoamine neurotransmission, and how it actually then globally impacts something like glutamate and excitatory, inhibitory neurotransmission, how it kind of messes up this homeostasis that we have in what we consider a normal plasticity situation or normal plasticity brain. Where do you see your research going? Obviously, you already mentioned like that this is a feasible target. It just needs to be further fine-tuned, so to say, to find the particular subcluster or subreceptor that can be targeted or is a feasible target. Where do you see your research going in the next 5 years or so?
Crystal ball. Yeah, so obviously we want to move. So one thing, and this is, I speak for my lab, for my research, but this is highly collaborative, right? So we have several collaborative projects with other labs, such as Dr. Nackstead lab or Dr. Settler lab and others. And so some of that research and sort of brought us that question um, to perhaps polysubstance use, right? Things like that. How's the plasticity and cognitive impact changes, or the profile of cognitive deficit changes when animals administer multiple drugs, right? Such as human subjects often do. And what is the role of so we try to look at confounding factors, and so one of these would be what if there's multiple drugs involved, right? Another confounding factor we want to look at in the future, what if a stress is involved, right? And so how do these confounding factors affect drug seeking? Is the drug seeking these polymorbid, comorbid situations higher, lower? Are there different characteristics about it? Is the cognitive deficit more profound, less profound, different? There's qualities that are different about that cognitive deficit. So some of these things we wanted to, sounds like a big question, but it's more narrow in these models we study, but this is sort of the questions we use. And so one of the things we just to maybe drive the point home, what we discovered is this a few years back in our paper in translational psychiatry on this comorbid cocaine use and stress, sort of traumatic stress. We found that animals that show sort of a high fear and anxiety responses, it's a subpopulation of animals that also take cocaine, they are resistant to interventions that normally work in cocaine animals. This sort of highlights. So we have some, interventions, glutamatergic interventions that seem to reduce cocaine seeking animals that don't show this exaggerated anxiety, fear, phenotype. If animals show that phenotype, so sort of this comorbid subpopulation, they would not respond to that intervention, this glutamatergic intervention, right? So this is somewhat like treatment-resistant condition, similar to real-life situations when subjects don't just suffer from substance use disorder, but also have a lot of different comorbid conditions. And so, yeah, investigating neurobiology of these, something like this, will be a thing for the future. What makes these animals different? There must be some neural substrates that are different, that they don't respond to this experimental intervention reducing cocaine
That is very interesting. I mean, we know that depression and anxiety as mental health conditions leading to substance use disorder. And we know this is tied to cortisol levels, right? If somebody has higher cortisol levels as an indicator of stress or anxiety, that might increase their risk of developing a substance use disorder or makes it more likely. So it sounds like you connect your postdoctoral work, neuroendocrine, to what you're doing now to some degree here as well.
I literally had a cartoon on this. I was invited to give a talk in my old institution to a stress crowd, and I sort of had this cartoon where fish comes out of water and then turns into a mammal, and then goes back and becomes a scuba diver, and he goes back in the water. So it was like sort of this my research life cycle of going back to my roots and looking at the effect of stress, as a risk factor or comorbid risk, that we know it makes not only symptomology more severe, but also the treatment more challenging, right? So that kind of we saw that in our very small window into this world by looking at this one experiment with these animals that seems like our animals were not responsive to treatment if they have that comorbid stress, anxiety-like condition. Yeah, so there's still a lot of things to research out there, and yeah, if we were successful securing some funding, we would like to continue in this because I think there's a lot of questions we have, and we would like to answer. And acquiring new technologies, big data. If you start looking at just sort of identifying the targets, like where do we want to target things in the brain in these conditions, because it's perhaps not surprising that the brain activity map in animals that are just have history of cocaine use or methamphetamine use, and animals that have a stress history, of traumatic stress like history, and psychostimulant use, the brain maps are not overlapping. So the activity of the brain is different. And so now you need to work a little bit with bigger data. You need to start do more complex analysis, multi-region correlational maps to sort of figure out what is the new circuit that might be a little bit different in these comorbid conditions. So we'll probably start doing things like that a little bit more to understand circuitries and things like that.
So I'm really excited to look forward to future research coming out of your lab and in collaboration with other labs, because I think that's the direction in which we are moving at UF in particular, with big data and artificial intelligence. Machine learning is one of these things that we are heavily invested in, or that we move towards. So excited to see you as well in that space. Thank you so much, Dr. Schwendt, for spending some time with us and explaining your research. And we wish you all the best for your future research. Thank you.
Thank you so much.